Well, February is Heart Month, and there are so many wonderful procedures that are helping people live longer, healthier lives. We've got Dr. Noah Thormeyer. He's an interventional cardiologist here at Trinity Health, talking about all these procedures. Thanks so much for joining us.
Yeah, thanks for having me.
All right, let's talk about ways treatment has changed when we're talking about structural heart disease. What does that mean?
So when we talk about structural heart, we're focusing not so much on the arteries or blood supply or blood flow to the heart, but the actual valve structures, the chambers of the heart, and doing minimally invasive procedures that can help fix some of those problems and help people live longer and better quality of life. So.
All right, so let's go down the list. There are several different things, and we've got some models here to kind of show off as well.
So, you know, the two main procedures we perform here in Trinity, Muskegon Hospital, are transcatheter aortic valve replacements, or TAVRs, which this model is kind of showing that. But basically, that's a procedure where people who have severe valve stenosis of their aortic valve, it starts to really limit their quality of life and how they're able to do activities. Also affects their quantity or how long they're going to live. So when they get into the severe range, we start to talk about valve replacement. And the TAVR procedure is a procedure that allows us to fix and put in a new valve without having open heart surgery for those patients.
Wow.
So it's a minimally invasive way for us to put in a brand new heart valve and give people better quality of life and enjoy things they like to used to do and avoid going into the hospital, and it affects them in a great way. And the other one we do is the Watchman device, which is a procedure where, again, minimally invasive, using catheters and wires, where I can implant this little device here that occludes a special area of the heart called the left atrial appendage. And by doing that, it allows patients to get off of their blood thinners and still helps them protect them from having a stroke, which affects them in a great way too, because they don't have to take the blood thinners, they lose the risk of bleeding, but they still have the benefit of being protected from having a stroke from their AFib. Wow. So, yeah.
So let's talk about how these procedures improve patient outcomes. Obviously, not having to have open heart surgery is a game changer.
For sure, yeah, for sure. Obviously, recovery is much easier for these patients. Avoiding a sternotomy and avoiding open heart surgery for a lot of our older, more frail patients is great. But also for other patients who have other risk factors and other health problems, that makes it more difficult to recover from open heart. It's a huge benefit. The procedures themselves, a lot of times when people have severe aortic stenosis, they're very tired, they slow down, they start to have hospitalizations for heart failure or other issues. It can affect just what they physically want to do and what they physically can do. So by replacing their valve, it gives them the ability to stay out of the hospital, feel better, and do more and enjoy their life more. So. Yeah.
And what sort of patients qualify for procedures like that?
You know, patients have to have severe symptomatic aortic valve stenosis, which is something that your family doctors and then your cardiologist can follow and monitor and treat until it gets to the point where they have symptoms, and then it's time to talk about replacing that valve. So those are the main patients that we're looking for when it comes to TAVR. When we talk about the Watchman device, patients who have AFib, who are at a risk of having a stroke because of their other health problems, but also are at risk of bleeding or have had significant bleeding events that need to get off their blood thinners. So.
Okay. And you know, being Heart Month, what should people keep in mind when they're trying to be proactive about their heart health?
Yeah, I think the biggest thing, especially when it comes to structural heart, is establishing care with a cardiologist and following very closely with your family doctor. These are the types of issues that develop as people age. So as people get older, these problems, you know, show up. So having some established care with a primary care doctor who can direct you in the right direction, and then establishing care with a cardiologist who can help manage those things and refer them to the right people. So.
All right, wonderful. And let's talk quickly about Trinity being part of this cardiovascular network of West Michigan and what that means for patients.
Yeah, I think it's a huge benefit for our region. I work closely with a lot of physicians in the area throughout Grand Rapids and up here, obviously, and we've already seen a huge benefit of helping some patients at U of M Health West and Trinity Grand Rapids, getting them in to get these procedures quicker than they would have otherwise, and having a team approach to getting the right care for the right patients as quick as we can. So
wonderful. Yeah. Lucky for all of us.
Yeah, absolutely.
All right. Well, thank you so much, Dr. Thormeyer.
Yeah.